Alright guys, our patient here has 3 symptoms that we need to consider for diagnosis.
Arthritis?
Trichonitis?
Swimmer's itch.
Exactly. Now, let me tell you this. It is Lipschitz-1-Fort's ulcer, and we're going to do decortication no matter what.
Wait a minute, Hawks. We can't just ignore our theories here.
Exactly, Leslie. I agree with her. We need to discuss this further before deciding on the treatment.
We've been over these cases countless times, Randall. It's always Lipschitz-1-Fort's ulcer and defecation.
Listen, you all, it's not going to be easy, but trust me. This is what the patient needs.
Frank, we can't just proceed like this.
We have to consider the risks and discuss them properly.
Well, our job here is to carry out Hawks's orders whether we like it or not.
You just said defecation instead of decortication a second ago. Operating a patient is not as easy as taking shit after binge drinking prune juice for a night.
Leslie, who the hell asked for that description? Now go decorticate the damn patient. Look, Tracy, I've been doing this for years. I know what I'm talking about.
And you've been wrong in countless cases before, Hawks. We can't risk performing a decortication just because you believe it's necessary.
You're making me out to be some amateur, Tracy. I've got experience, and that's what counts here.
Experienced or not, we need to look at the facts before us right now, Hawks. We can't ignore the potential risks involved.
I'm telling you, this is a Lipschitz-1-Fort's ulcer. I've seen it all before.
You've seen all the ulcers? Okay, name every one of them.
In the old country, they were called Tracy's, until one grew up too big and became my boss.
Get out!
Dr. Frank, I am truly sorry to hear about the critical condition of our patient.
Absolutely. The decortication procedure was not the ideal treatment for Lipschitz-1-Fort's ulcer in this case.
Indeed, it seems like we have been misguided by Hawks's insistence on the wrong treatment. We shall consult with other specialists to find a more suitable approach.
I understand that you may be frustrated with my suggestions, Randall, but I believe reckless ideas could lead us to explore new horizons in medical science.
You wanted to revisit the fidget spinner misadventure a moment ago. We're not doing that again.
You 3 are a bunch of idiots. How could you make such a grave mistake? Lipschitz-1-Fort's ulcer is not a misdiagnosis. Decortication was the right treatment.
We were just trying to do what we thought was best for our patient, Hawks. We didn't intend any harm.
The diagnosis seemed accurate at the time, sir. Perhaps we could have been more cautious, but we didn't mean to hurt him.
We're all doctors here, Hawks. Sometimes even the most seasoned professionals can be mistaken. We'll learn from this and improve our practice.
Improving? By the cosmos, you need to start learning now. You 3 are just incompetent fools. I'm leaving to get lunch. Don't expect me to come back until you've figured out what went wrong. Well, Johnson, it seems like your oncology department is doing quite well.
Yes, indeed, Hawks. We've been making some significant strides with our research.
That's great to hear. I'm sure you and your team are very proud of the work you're doing.
Thank you for saying that, Hawks. However, you seem a bit distant today. Everything all right?
Oh, yes. Just thinking about my own case here. You know, it's quite perplexing.
Really? What's wrong with your patient, if I may ask?
Pauses. Nothing that can't be fixed. But I don't want to bore you with the details of my work, Johnson.
No, it's all right. I'd love to hear more about what you're working on, Hawks.
Well, it seems our patient has been suffering from a rare form of pauses. Let me just check something here. Hawk suddenly jumps up, dropping his fork and rushing off without saying goodbye.
Now, who's gonna pick that up? It's always me, isn't it?
I know what I'm doing. You can't just walk into an operating room without proper equipment. It's dangerous.
You're right, but we need to follow protocol.
Protocol is crucial. There are rules for a reason, Hawks.
And they were put in place for everyone's safety. Can you just give us the details of your new diagnosis?
Fine, I'll explain it. The patient has Lipschitz-1-Fort's ulcer. It's a case of list of infectious diseases. And I figured out how to treat it during lunch with Dr. Johnson.
But what about the prognosis?
The prognosis is
Well, do tell us.
We're all ears, Hawks.
you know what? You're right about me being wrong with the diagnosis.
That's great, Hawks. So, what's the prognosis for the patient?
Lunch was interesting today. I think I dropped my fork at the discovery of the real diagnosis.
What about the patient?
They were presumably unconscious when I had that brainstorm. It's the damnedest thing.
No, I'm specifically asking about the prognosis.
Oh, that. The prognosis is a declaration of what I, as a qualified doctor, would expect in my patients being after a diagnosis.
What do you expect in the patients being after you found the real diagnosis?
We're running short on time, but it turns out the patient is gonna...